Welcome back, guys. So today we are going to give a very brief description of enzyme linked immunosorbent assay, or you can say ELISA. I am going to discuss with you in a very brief and within 10 minutes the whole funda of enzyme linked immunosorbent assay, and I am guaranteed you that you can answer anything from enzyme linked immunosorbent assay after that. Okay, so let's get started. So what is enzyme linked immunosorbent assay? Let me zoom. Mm, yes. So sorry. Hmm. So enzyme linked immunosorbent assay means by its name enzyme linked. That means we are going to use a molecule that is linked with enzyme. Immuno means immune complexes. Okay. And sorbent means it is adhered with a surface. That is why they are telling us sorbent assay. So ELISA, the name enzyme linked immunosorbent assay, try to tell us that with the help of enzyme linked molecule we are going to detect a immunocomplex that is adhered on a solid surface, and that is exactly what ELISA is. So the first and most basic ELISA is our direct ELISA technique, in which we have coated our antigen of interest in a microtiter plate, and then we block the remaining area with the help of a blocking agent. We have done this because these microtiter plates are made up of polystyrene. Okay, so if we do not block it with the help of blocking agent, then the antibodies can also react with them and give us a false result, and that can be a problem. So for getting rid of this, we have to use blocking agent. Okay, after blocking agent we will add primary antibody, and primary antibody will interact with the antigen via its FAB portion, and this primary antibody in case of direct ELISA is conjugated with enzyme. Okay, and then after washing, when we add the substrate which should be colorless, with the help of enzyme it will convert it into a colored product. Okay, so this is the direct ELISA technique. But there are some problems in direct ELISA technique, because remember one thing, if some antibody is conjugated with enzyme, then the affinity for that antibody towards a particular antigen will be less. So this antibody does not bind well with the antigen that are coated on the microtiter plate, and that is the reason sensitivity will be less and specificity will also be less. Sorry, for that reason specificity will be less. And remember that, now think, if we are going to consider a very complex sample where there is a multiple antigens and we need to find out one. Suppose there are three type of antigen A, B, C, and we need to find out B. So it could be it become difficult for a primary antibody conjugated with enzyme to finding out B specifically and with a great intensity, right? So for this we need to modify this direct ELISA into two different techniques. So remember this, we need specificity in some cases and we need sensitivity in some cases, and in another cases we need both too. So we need to modify this direct ELISA technique in three possible ways. Okay, so for providing sensitivity, when we are talking with when we are considering multiple antigens and we need to find out only one antigen among them, then we will go for indirect ELISA. So what we have done here is, here we take our microtiter plate in which we have coated the antigen of interest, then we block the remaining areas with blocking agent, then we add primary antibodies that is not conjugated with enzyme, and this primary antibody is monoclonal. Remember this thing, monoclonal means this primary antibody showing specificity towards a certain kind of antigen. Okay, now this primary antibody is injected into another animal, and so what will happen, this this particular animal will produce antibody against that particular antibody. And we know, come here, sorry. And we know that antibodies has multiple determinant. Okay, so when we add this primary antibody to another animal, it will produce antibody towards different determinant of that particular antibody. So after that we will add those, so we can say these antibodies as polyclonal. Okay, so polyclonal, so then we will add this polyclonal antibody here and it will get attached with different portion, and these antibodies will be enzyme linked, remember, and we can call it as secondary antibody. So secondary antibody will be added and then washing will apply, and after that if we add substrate then it will convert it into colored product, as there are multiple enzyme linked antibodies present, so the intensity of the color will be higher. So spectrophotometer find it easy to detect the sample. Okay, so remember one thing, this is all about indirect ELISA. Remember one thing here, the problem that is going on in case of sensitivity, when we are talking about a very complex sample containing multiple antigen, this problem can be solved with the help of this indirect ELISA technique. Here the primary antibody is monoclonal and secondary antibody is polyclonal, showing the specificity towards different epitopes of the primary antibody. Okay, so I hope it is clear. So it is our indirect ELISA technique. Now let's move. Now we are going to talk about how we can provide this specificity. Okay, so for providing specificity, you need to know this thing, that antigen have multiple sites by which it can interact with antigen, and we can say those the sites as epitopes. Okay, so the main goal of sandwich ELISA is that we are going to capture antibody, or we can going to interact with antigen in a to different epitope, or with two different epitope to provide more specificity, right? And that what we have done here. In sandwich ELISA, instead of coating the microtiter plate with antigen, we coat the microtiter plate with antibody. So we can call it as capture antibody, or you can say that as this antibody as primary antibody. Then we add our antigen of interest. This antigen of interest bind with FAB portion. Then we add the enzyme linked secondary antibody, and we will add the substrate, and this substrate will convert it into product with the presence of enzyme. Okay. So as here the antigen is countered by two epitopes, so it can provide us specificity, right? That is lacking in case of our direct ELISA. As I have told you that if a antibody is conjugated with enzyme, they find it difficult to interact specifically with the antigen of interest, right? Or you can say the affinity of the antigen antibody reaction will be weaker if the antibody is conjugated with enzyme. So we can get rid of this with the help of this process, a little modification by using two antibodies. So here, as antigen is sandwiched between primary antibody and secondary antibody, so we can call this process as sandwich ELISA. Now we need to focus on, in some cases where we need both specificity and sensitivity, and in that case we need to modify the ELISA technique once again, and for that basis sandwich ELISA can be divided into two parts. The previous sandwich ELISA that we have already talked about is the direct ELISA, and now we are going to talk about indirect sandwich ELISA. Okay, by name I think you already find out what we are going to talk about. So here first of all, primary antibody will be conjugated, will be coated in the microtiter plate, then blocking agent are added, then we will add the secondary antibody. So but in that case this secondary antibody is not enzyme linked. Okay, then we will inject this secondary antibody to another animal to develop polyclonal antibody against that secondary antibody, and we will conjugate those antibodies with enzyme and add it into the sample, and after that we will add our substrate, and our substrate give color product. So in that way, in indirect sandwich ELISA we provide both sensitivity and specificity, right? So the main funda is our direct ELISA, where only one antibody is used, and here we have two problems regarding specificity and sensitivity. The specificity, as enzyme linked antibody does not provide interaction with our antigen of interest with a higher affinity, right? So that is the reason we have made this sandwich ELISA. And in case of when we are talking about a very complex sample, so we need to the sense intensify the color emitted by a colorful product. So we need to increase the concentration of enzyme linked antibody. So we have developed indirect ELISA for solving those problems. And when we are talking about those both specificity and sensitivity, then we will move to indirect ELISA. Now I think you have a question that what those enzymes are. So those enzymes are Horstedis peroxidase, alkaline phosphatase, urease, beta galactosidase. You can use one of these four enzymes. And substrate used in case of Horstedis peroxidase are tetramethylbenzidine with hydrogen peroxide, in which hydrogen peroxide is our substrate, which on react with Horstedis peroxidase give its oxygen to tetramethylbenzidine and leads to the formation of tetramethylbenzidine oxide, and which will give blue in color. You do not need to bother about this thing, as I am going to talk about this in details in our next video, where we are going to talk about dot ELISA. Before that, a brief discussion on what ELISA is needed. So that is the reason why I have made this video. Okay, so I hope it is clear, and if you find it helpful, please hit the like button, subscribe my channel, and share with your friends. Okay, thank you.